The patient is performing physical exercise. They suddenly experience a sharp pain in the chest. The first step is to check the safety of the surroundings. Make sure to wear personal protective equipment like masks and gloves. Ask the patient if they are feeling okay, check the responsiveness, and immediately activate emergency medical services. Call 112 if you're in Russia. Check the patient's airway. In this case, the patient is able to breathe, so the airway is open. Check for circulation. What is your name?
My name is Bolanle.
How old are you?
I'm 55 years old.
Okay. What is your occupation?
I'm a welder.
Okay. Where do you live?
I live in Atiskaya Diva.
Okay. What are your main complaints?
I'm feeling chest pain.
Okay. Can you describe this pain?
It is a severe crushing pain, and then it radiates towards my back.
Okay. Are there any additional complaints?
Yes.
Okay.
I feel faint and I feel weakness, and I have difficulty in breathing.
Okay. How long ago did you start experiencing this?
It started 20 minutes ago while I was exercising.
Okay, now I will ask you your personal history. So, have you ever had a gastric ulcer?
No,
No. Do you have any allergies?
no,
Have you ever had blood transfusion?
no.
Okay. Do you smoke?
Yes.
Do you consume alcohol or drugs?
Yes, I use alcohol and drugs.
Okay. Do you have any family history of such
No.
disease? No. Do you have diabetes mellitus?
Yes.
Have you had operations in the past?
No.
Do you have tuberculosis?
No.
Okay. Do you suffer from a stroke?
Yes.
Okay. Do you suffer from angina pectoris?
Yes. Presently.
Okay. Do you take any medicines?
No.
Okay. Thank you. As we can see, the patient's condition is severe. It is an emergency condition. The Glasgow Coma Scale, the patient has normal eye opening, so we give that 4 points. Could you flex your arms for me? Okay. The patient shows obedience to command, so we give that 6 points. And do you know what day is today?
Today is Saturday.
Okay, good. The patient has oriented conversations, so we give that 5 points. So the Glasgow Coma Scale is 15, which is alert. The patient looks older than their age. Their skin is pale and cyanotic, and their temperature, we'll check with this thermometer. Okay. Their temperature is normal. So, do you have a running nose?
No.
Do you have watery eyes?
No.
Actually, I can see this here. Okay. Do you suffer from cough?
Yes.
Yes. Are there secretions when you cough?
Yes, it's productive.
So you see sputum. What is the color of the sputum?
Light pink
It's like,
and foamy.
okay. You can see the patient breathes with both their lungs and their abdomen. Okay. We see the respiration rate is 30. There are no wounds on the chest. There's equal expansion of both sides of the chest. And we see retraction of the chest, which means movement of the intercostal spaces. So now I will perform percussion. Could you turn around? Fold your arms, please. Okay. On percussion, we hear dull sounds on both sides of the chest. So now I will perform an examination for the vocal fremitus. Could you say 99?
99, 99, 99, 99, 99, 99, 99, 99.
Okay. We hear low vocal fremitus on both sides of the lungs, and I also heard crackles on auscultation. Okay, could you show me your pulse? Okay, now I will check your heart rate. The patient's pulse rate is 120 and their heart rate is 100, which means there is a pulse deficit of 20. The patient has a failure of the respiratory and cardiovascular system. The partial pressure of oxygen is expected to be low. The partial pressure of carbon dioxide is expected to be high. The lactate levels are high because of decreased oxygen levels, and the pulmonary artery wedge pressure is expected to be high. This is because in patients with heart failure, there is increased preload in the left ventricles due to decreased contractility, which drives the increase of pressure in the left atrium, which drives an increase in the pressure in the pulmonary vessels. This is because of congestion. So the patient has respiratory failure. This will be a secondary form of respiratory failure resulting from cardiogenic pulmonary edema. As for treatment, the patient has to be administered nitroglycerin for vasodilation, loosen clothes, and fix the positioning of the patient. We already concluded that the patient has cardiac and respiratory failure, and we cannot administer normal saline. This is prohibited to stop fluids. We already know that the patient has pulmonary edema due to increased fluid buildup in the alveoli. Instead, we have to give diuretics to decrease the fluid volume, we give oxygen therapy, and we give inotropes to increase the pumping action of the heart.